And now for the moment you've all been waiting for, corporate governance. So let's move on very swiftly to page number 160. And we now have the Audit and Risk Management Committee. Unfortunately, as I said earlier, Paul King, our chair of that committee, is unfortunately ill today. But Rahul, you're a member of the committee. I just wondered if in his absence, you could just sort of say a few words in terms of by way of introduction to the paper that Paul wrote.
Of course, Chair. So the committee met on the 11th of December of last year, and we went through a series of reports, the external audit draft plan, recommitting to our existing external auditors. We reviewed a series of internal audit reports that two received substantial assurance, one was advisory. We looked at our risk management reports in totality, looked at committee effectiveness, and reviewed three policies that actually are attached as part of the board papers here. That's the update, and
Okay.
open for questions.
Okay, so the committee's clearly done its due diligence and its work. Any questions on any of that, or can we duly note it? That was a leading question, correct answer. So we'll therefore duly note with thanks the assurance from the Audit and Risk Management Committee. That takes us on to page number 166, which is the Board Assurance Framework, and of course that's aligned with the full Board Assurance Framework in the appendix documents as well. Hannah is our sort of lead on executive lead on governance. You can assume the board's read the paper, but any key points that you want to bring to our attention?
Yes, thank you, Chair. So the report articulates the work that has been carried out in review meetings with all the chief officers during December, and there's quite a lot that is of strategic developments that have moved forward for both the system and an NHS Sussex level. However, even saying that, those 7 risk scores remain unchanged. I will just note the risk ICS 7, which is on the digital risk, and we had a conversation about that at board last time, so that risk remains the same, but there are 2 risk scores that I've reduced. So for risk 3, which is strategic commissioning, we've reduced that due to progress against all the actions to date with the approval of the strategic commissioning policy and framework. And then also risk 8, which is system partner collaboration. So significant progress has been made on the actions to mitigate that risk, and so that risk has been de-escalated. So this is a request to boards to approve the de-escalation of risk 8 because it's now below its target score of 12. So this would take it off the board assurance framework and off the sort of the focus of the board and be managed as an operational risk. That's a specific ask of the board. Thank you to approve that.
So, colleagues, any reactions or comments? Rahul.
Thank you, Chair. With regards to system partner collaboration, so the de-risking of basic, well, number 8. Obviously, we're in a very good position at this point in time, but I have concerns that partnership working may change over time, depending on who is participating within those conversations. So rather than remove it from the board assurance framework, keep it there, but at a de-risk state. Otherwise, we lose the potential of I guess, the history of that improving, but also how that may change over time.
But presumably, just to answer that, Hannah, I guess if it did drop to the operational risk level, if that risk increased, it could presumably come back up to the board assurance framework.
Yes, so it will continue to be monitored, and we would report it as part of the operational risks that are in the paper as well.
Right.
So yes, it would still be monitored, and if risk comes up, then it just comes back onto the back.
So if we're to do that, Rahul, I think that might answer your question. Actually, you don't want it to be lost.
No.
Because there is a potential change there.
Yeah.
Just as we're talking, if I may, just on this particular risk, can I just check when the recommendation was made to de-risk it? Did you take into account the senior leadership changes both in NHS Sussex? So we've currently got an interim chief executive and interim chief people officer. East Sussex Healthcare Trust has got an interim chief executive and they're appointing a new person. CCAM are just losing their chair. SASH has just got a new chair. There are interim executives at QVH. There's a chief operating officer vacancy at University Hospital Sussex. So there's quite a lot of churn within the NHS senior leadership within the system, and then I also slightly worry about devolution, because I do worry that with devolution our local authority colleagues will inevitably get very distracted by not only the mayoral situation but particularly on the local government reorganisation, and would that get in the way of the system partnership work? And I'm just wondering, can I have some assurance that that was considered when the recommendation was made?
So I think, of course, all these things happening at different times, and they sort of build on each other. And this was the work done to December. But I'll let Amy.
Yeah, so when considering the risk score, we clearly look at the actions that we what needed to take over the course of the year and the actions that we committed to in respect of this space. And those actions have been done.
Right.
And that is kind of why we've reflected that the risk score needs to decrease. Now, clearly things happen and the context around us changes, but I think it's important to note that this is about things that are within our control. And if I just stop to think about some of the points you made about our own organisation, that is why we have, leadership succession plans. That is why we continue as we are. We have an interim chief exec in place. We have an interim chief people officer in place. And our business hasn't been impacted by a change in leadership as far as I can see. And that's what we would expect of all other organisations in our system. I think we're trying to make sure that we are focused on delivering our strategy, because people within a system do change, but the commitments we made about delivery of a plan don't and shouldn't. And that is why I think we've reflected that actually, all things considered, this risk is de-escalated because of the fact that we've delivered on our actions, and we continue to monitor it and refresh it as part of the refresh of the BAF.
Okay.
For the next financial.
I think that's a powerful point. But Mark, do you want to come in?
Yeah, thank you, Stephen. Whilst we get very excited about things like devolution and local government reorganisation, I can't see that presenting an immediate continuity risk at this stage. It's 3 years away, and I guess you need to remember every local authority has an election every 4 years, and that can equally impact on relationships.
Okay, Jane.
So I agree, and I think there's something for me about it. Intuitively, it feels right to go down. So if you think we've had all of the executive teams across all of the providers and the ICB for a whole day together twice recently to talk about the planning for next year, that's a very different feel than even a year ago. I feel comfortable with it going down because there's the safeguard of it coming up again if it needs to within the context of the planning guidance we're expecting. There are risks attached to it, but it can always come back again.
Yes.
I think it's a point in time and recognising the work that's been done.
No, I think they're all good points. I'm just aware that obviously risk number 8 is one of the system risks, that our intention over the long term is actually to take that through the committee in common to get a system-wide perspective on that, and so that would start to take it outside of our NHS Sussex control. But at the moment it's part of our NHS Sussex board assurance framework, and what I'm hearing is a strong compelling argument to say that yes, the proposed risk of 8 is justifiable and assured. So that's what I've heard. Does anybody disagree?
I'm not disagreeing. I'm just saying, and I think that when we come to look at the BAF for next year, we'll be able to reflect on a risk appetite. So of course this reflects the target. Exactly. The target for this risk reflects the risk appetite that the board and the audit committee agreed earlier in the year. So I think we do need to, to stick to what we said, but then with the opportunity for it to come back and be reconsidered again next year.
In some ways I would be slightly mischievous to make sure that we had actually thought it through and we weren't just sleepwalking into reducing it without any sort of challenge. But I think the way the system is working better now than it's ever worked before. There's still improvements we can make, but it feels in a different place to where it was a year ago. So I'm completely supportive, ironically, of reducing it, but I wanted just to check that everyone else was equally content. Okay, so as a decision then, we are saying that we will de-risk system partner collaboration. It will come out of the board assurance framework. It'll go into the operational risk register. If that operational risk increases, to Rahul's point, it will come back to the BAF. Everybody content with that? Okay, so we've got agreement on that. And then also on strategic commissioning, there's also a proposal there to reduce that from 20 down to 16. Can I just check everyone is content with that from what the papers have said? again, I think there's been some good examples of the actions we said we were going to use as mitigations have been implemented. So it seems reasonable, although it's still at high risk. Okay. Were there any other comments on the board assurance framework? Rahul?
Thank you, Chair. It's in relation to our conversation on the cardiovascular disease, and actually the point that Siobhan raised with regards to prioritisation of our ICT activities. And I wonder whether we've suitably put that within the assurance within either the system partner collaboration or one of the other areas of the board assurance framework to ensure that prioritisation and the governance around it is suitably dealt with.
It strikes me as quite operationally, as it's definitely a component of the activities we need to pursue. But does that fit on our strategic board assurance framework? Was the question I would have.
Well, it's interesting, isn't it? Because there's the elements of the ICT in terms of mobilising, but then there's the external influence on what they focus on in terms of the CMO network, in terms of population health, etc. So how do we prioritise what they do versus what is done at a regional level? So there's a kind of like a change management approach to it, and that itself is operational, but I think there's a governance element that needs to be thought through.
Is this maybe something to think about for the next BAF?
It might be. I'm just wondering if we perhaps offline try to articulate what the risk is in there. What the risk is. It's because it's either a programme sort of management in terms of the deliverables and the prioritisation, or there's a risk in there which we then work out which does it fit into, or is it something we put in now or as part of next year?
Sure. Yeah.
Because I think while the plans are still emerging from the paper that James just presented, we're getting towards the end of the year. I think trying to change the BAF at this stage for the 2 months probably isn't the sensible thing to do.
Sure.
But articulating the risk for next year, if we think it is there, would seem like a good thing to pursue.
Makes sense.
Is that okay?
Yeah.
All right. So, board assurance framework. Any further questions or comments? Okay. On that basis, we've discussed this most. Well, I think we've looked through this. We've approved the latest articulation. We've approved the reduction to risk scores. So on that basis, I think we can say we've noted the report and taken the actions requested. Okay, thank you for that. That leads us on to page 178, where we've got 3 policies which have been updated to varying degrees. Hannah, you can assume that they've been read, and obviously the full policies are in the appendix pack. Anything else you want to add?
Just 3 important policies for the organisation. They've been through Executive Committee and through Audit Committee. Conflicts of interest policy, quite a lot of changes to that, but really based on the guidance from NHSE. Nothing else other than that. The standards of business conduct policy, only very immaterial changes, and then the fraud, the fraud and bribery corruption policy. So that has just had the addition of the anti-money laundering procedure, which was an unadvised recommendation from Counter Fraud. So those are the key changes to draw your attention to.
Great. And obviously, Rahul, you mentioned in the Audit and Risk Management Committee report that actually these 3 policies were reviewed by the committee, and I am assuming that the committee was supportive.
Yes.
Okay. All right, that being the case then, so the full conflicts of interest policy is in page 168 of the appendix pack. Can I let's go through them one at a time. Can I just check if, first of all, are there any questions? Can I ask if the board is content to approve that revised conflicts of interest policy?
Yes.
I've seen nods around the table. So yes, the conflicts of interest policy updated is approved. The standards of business conduct policy is on page 212 of the appendix pack. Can I just check if there are any questions or comments on that? Can I ask if the board is content to approve that revised policy? Relatively minor changes by comparison, I think, to be fair. Okay, approved for the minutes. And then the fraud, bribery and corruption policy on page 231 of the appendix pack. Again, any questions? No, and therefore, is the board content to approve that policy as well? Approved. Okay, so Kerry, if you just please note that in the minutes, that would be great. Those 3 policies have therefore been approved. Okay, just moving on, if I may. Page 181. There's a new addition to the board packs, and that's a chairs report. Certainly, when we established the organisation, my view with the previous chief executive was actually if we could capture most of the content in the chief executive's report and do it once rather than just having a report for the sake of it, that felt like a better and more efficient use of time. I think in recent months and over the last year, I think part of my role has started to expand into getting involved in other governance processes. So, I'm now a member of the 3 health and wellbeing boards: West Sussex, East Sussex, and Brighton and Hove. Until yesterday, I was a member of 2 of the economic growth boards in West Sussex and East Sussex. And as of yesterday, I'm now a member of the Greater Brighton Economic Growth Board as well, to add to my portfolio. In addition to that, I've also been chairing the Sussex Health and Care Research Partnership. We'll have a proposal coming forward at the next board on that. And then I've also been involved in a national initiative called the Red Tape Challenge, along with Siobhan and also Louise from our board as well, which is a Secretary of State and NHS Chief Executive-led initiative to reduce red tape in general practice. So I just thought it was appropriate just to make sure the board was cited on some of these activities, because actually I don't want this to become a side issue. I wanted to do it in full transparency. But I think it's also important that actually the minutes of all of those statutory meetings will be appropriately publicised and given on the relevant website. So all I've listed here is these are the agenda topics that were discussed. So I just wanted to give you awareness that activity is ongoing. I'm happy to take any questions if there are any, but it was more just to keep you cited on some of the wider system-wide involvement that I've got. No comments? So on that basis, can I just ask, is it useful to receive this on an ongoing basis?
Yeah.
Just to complete the loop? Okay, so we'll continue to do that then on that basis. All right, thank you very much for that, and therefore we'll just note the Chair's report. That takes us on to public questions, and as I said at the beginning in my introduction, we do provide the opportunity for members of the public to submit questions in advance on issues related to the agenda. We also get some questions that have already been asked previously, or questions that actually are not related to the agenda, and what we'll do with those individual questions, we'll go back to the questioner directly in writing rather than cover them now. But there are 3 topics, 3 questions I think are worthy of sharing with the board right now. And the first relates to Sussex non-emergency patient transport. And the question is, does the assurance given, and this is referenced in the Executive Committee report, does the assurance given mean that the following have been successfully completed or currently being actioned? Data migration and the addition of new data as generated by the current supplier. End-to-end testing of the new supplier's processes for registering and actioning requests for transport and the communication of transport information to users, and the completion of the communications plan for current and future users, and the distribution of communication details like telephone numbers or the website to both users and providers. This is actually really quite an important service, and Claudia actually is responsible for the commissioning of this. Do you want to provide some assurance on what's happened with the mobilisation?
Absolutely. So we, as you just described, Chair, it recognised the criticality of this service for the population in Sussex, and it is a significant contract that was re-procured earlier this year and awarded to EMED. Because of the significance of the contract and the importance of the service, there has been and is ongoing a really detailed programme of mobilisation with that provider. So from the point of the contract award being made and that being publicised, there was a kick-off of a detailed mobilisation programme that our commissioners have been involved in, and there are weekly mobilisation meetings with that provider that include both our commissioning teams but also the existing provider to ensure that there's a smooth handover of that contract. So that detailed mobilisation process picks up all of the things like the data migration, the end-to-end testing of processes. But because of the importance of the contract, it's just important to note that myself, Mark Smith and Alison Cannon met with executives from EMED earlier this week to walk through in detail and gain assurance from their executive team as to the view of how well progressed they were with the mobilisation, but also to enable us to seek assurance from them around particular key areas. And through that conversation, we covered off things like the progress with the estates mobilisation, and important to note that they're now progressing with the fit out of the main depot. They're well progressed with the ordering of the fleet vehicles. The staff recruitment is going well, and the staff recruitment in particular is will be one of the key risks around this. So it was really positive to hear the progress that they've made. I think just the other bit to touch on, they've had a dedicated head of operations in place overseeing this mobilisation since October. They have, I think it's fair to say, they have been mobilising a number of contracts with different ICBs in recent months, and in parallel with the mobilisation of our contract. So making sure that they've got sufficient oversight of this mobilisation has been important, and they recognise that some of the issues that they've had with previous mobilisations have been linked to that, I guess, a lack of dedicated resource. So that head of operations is really important. And the other key bit to note is their dispatch team, which links through to the process reference, particularly around that actioning of transport requests. They've gone early with the recruitment of that dispatch team. They'll have 7 full-time people involved, and they've got 4 of them recruited and doing the onboarding already. So again, a really key element of a successful mobilisation that they were able to demonstrate they're well progressed with. So I think through the mobilisation programme that is ongoing and will run up to the point of mobilisation, and the assurance conversation that we had them earlier this week, I think we've got a significant level of assurance around how that mobilisation is progressing.
And that mobilisation includes detailed communications with the users
Absolutely.
of the service, doesn't it?
That was one of the things we discussed with them earlier about the importance, not just with users of the service, but also staff who will need to book the transport and understand the changes that are coming to make sure that it's successful. So yes, one last point. The mobilisation team will be in place post the go live for the first 3 months to again be there to do any rapid problem solving that needs.
Right. And I think what I've also noticed is that when concerns have been raised, so as an example, I went to the East Sussex Healthcare Trust annual general meeting. A member of the public came up to me and actually was expressing concerns about the transfer to this new provider. So I put them in touch with the commissioning team, and there was a detailed discussion with that individual. So I think where there have been concerns raised, we've addressed them directly, and I think that's something I've noticed. I think it's been a very helpful result to that. So, okay, well, thank you, Claudia. Thank you for that answer. The second question that we received relates to artificial intelligence and technology. And the question is, as the adoption of AI continues to shape the delivery of mental health care, what is the ICB's approach to leveraging these tools to enhance outcomes, improve efficiency, and ensure equitable access to services? Additionally, if you are a third party that is being able to support the ICB strategies and priorities, who would be the best person to contact regarding this matter in the first instance? So James, why don't I ask you to come to this, and I may ask Jane for comment as well.
Given the mental health angle. So I think the first thing to say is that yes, we recognise the benefits that artificial intelligence brings, not just within NHS Sussex, but across all of our providers. And we've already adopted some of that technology. Examples would include computer-aided decision-making to facilitate better clinical diagnosis, but also some of the issues around radiology reporting. Now, obviously, the benefits of artificial intelligence are to drive efficiency, but we are really conscious that we need to maintain patient safety, but that's central to this, and we need to make sure that it's well regulated. So it's not just about improving efficiencies for our workforce, which is obviously important. I think before I ask Jane to come in on the mental health piece, I think regardless, we need to ensure that where our organisations, or more systemically, or whether it's regionally or nationally, where we adopt programmes, we go through the appropriate procurement channels, because I think, how we incorporate these services needs to follow the appropriate avenues.
Great. Sorry, Jane, you're not prepared for this, but is there anything else you want to add to that?
I suppose there are pilots in Sussex around mental health and the use of AI, particularly in the West Sussex area, that we're learning from. There's also exploration around some of the more corporate functions around things like there's some really good pilot work that's been happening in Berkshire around in complaints and incidents and looking at themes and pulling out things that maybe with human error you don't pick out and things that we're exploring within mental health, how that could be translated to mental health services to triangulate the data across serious incidents, complaints and key performance indicators.
Yeah, and I certainly know that your chair of Sussex Partnership
very
Trustees
keen.
is very enthusiastic about the opportunity for
Yes.
digital technology in the treatment of mental health
That's right.
conditions,
And that's
as
what
well
the
as the
pilot,
data.
yeah, that's what the pilot's about, is the treatment, and then the data is the complaints.
Great. Okay, thank you for that. The third question then today is about the NHS app and the My Health and Care record. And the question is, what work is being done to establish which aspects of the NHS app and My Health and Care record are most useful to patients or users? Amy, can I maybe ask you to comment on that?
Sure, thank you, Chair, and thank you to the member of the public for having submitted this question. We referenced part of my answer earlier on in today's board meeting, but just a couple of things, I guess, to say on this, which is the NHS app is a national product, and the development of that is led by NHS England. So they do take on responsibility for making sure that there is user feedback on the development of it. But you will have heard us reference earlier today the fact that in Sussex we have a digital and data people's panel that is well established and focused on supporting us develop our patient-facing digital tools. And the national NHS app team actually came and spoke to our panel in September of last year and tested some of their ideas of further development on the app with them. And I think that has been really helpful for them, but also helpful for our panel to have a direct voice into that national work. In terms of My Health and Care record, this is our version that I guess predated the NHS app, but also includes local authority information. And the panel engages proactively with the development of that work. And they are working with us to develop personalised care and support plans at the moment. That is a specific component of that tool. I guess the one thing that I'll finish by saying is that we're currently reviewing these two patient-facing applications, because it's quite important that we have a single front door for people to access in relation to their health and care, and we want to make sure that we've got the right approach to this moving forward. So I think hopefully that answers the question.
I think there's a lot of activity going on in this area, so thank you for that overview. It's really helpful. Okay, as I said earlier, there are three questions that seem the most relevant today. The other questions that we have received will be answered in writing, and we'll also make them available on our website as well. So that takes us on to the final item on the agenda, which is page 188, which is the forward plan. So during the meeting, actually, in addition to the topics that are actually already listed out, there's a few things that we've talked about today that are not on the forward plan. One is the Sussex Health and Care Research Strategy, Improving Lives Together Through Research, is due to come in March, so we'll need to add that onto the forward plan. We talked earlier about adding discharge and children and young persons' mental health to come back to this particular board. And I think also there was an offer, James, in your cardiovascular paper around a paper around clinical outcomes on cancer, clinical outcomes on respiratory disease. So I don't think we can do all those in March. I think it's fair to say. You'll be pleased to know. But I do. But I
Got
do.
me worried there, Chair.
No. Honestly, I'm not going to do that to you. I think we'll take it offline. So if we just take an action just to see how can we incorporate those additional papers through the year, as opposed to through the quarter, because I think we've also got a plan to produce in the next quarter. To be fair, James. So there were the points that I noted that we need to add to that. Was there anything else that anybody else thinks is missing or should be moved on the forward plan? Okay, so with those additions, which we'll take offline and during our sort of board planning agenda, we'll work that one through. Okay, so that brings us to a few closing remarks, if I may. So the next board meeting in public will be held on Wednesday the 26th of March, and we're going to go to the King's Weald Community Centre in Burgess Hill, so back up to mid-Sussex. Before closing, I would just like to thank everyone present today, both board members and presenters, for your contribution and the contributions you've made during the discussion. Also to thank all the staff involved in writing papers, going through the committee work, and also then in the organising the meeting as well. Perhaps even more importantly, I would just like to thank the 43,000 NHS staff in Sussex who are working and have been working so hard during an incredibly busy winter period. And our thanks go to each and every one of them for the work that they've put in. It's a difficult situation and a difficult environment at the moment, and it's very easy to focus on the things that are not going so well. But just if I think about during the meeting today, a few of the things that are going, really much better, then I think we should just bear in mind that despite all of the challenges that we face, and we know discharge and the money are both very difficult issues for us. If we look at all of our performance metrics that have been set nationally, we are still at or just above plan on 16 of the 24. So let's keep in 2/3 of our plan we are delivering. The areas that we've got focus on are the areas where we're under delivering, and we're very much focused on that. We should also remember that we shouldn't lose sight of we're delivering record numbers of GP appointments, and we've been increasing the number of GPs in our system when many other systems are not doing that. So that feels like a positive move forward. Our urgent and emergency services are very, very busy, but actually if you look and compare with other systems around the country, you'll see that the Sussex urgent and emergency care performance is in the top quarter of the country. Our planned care waiting list is still too big, but it is coming down, and it's coming down at quite a rapid rate of knots, which isn't always the case elsewhere. So I just wanted to make the opportunity to say that everything is not, there's a number of things that are going really quite well in this system. We understand the challenges and we're dealing with them. But I think also we're very focused on delivering in the long term too. And that's why the delivery of our strategy, Improving Lives Together, is so important. We continue to be committed to do that, and we'll continue to protect that during the planning process we're about to embark. So with those closing comments, I'd just like to thank you again for your attention. I'd like to close the meeting and say, see you next time.